I'm like, you're trying to get pregnant, but you're taking something that just prevents you from getting pregnant. So it's very important that you actually know the name of the drug you're taking, and even going beyond that, to know what the effect of the drug is on your body. J5. Hello, welcome back to my YouTube channel. I know it's been a minute to have a sit down video, but don't worry, I'm back and I'm back with more juice. If it's your first time stopping by this channel, I'm Dr. Hilda, and there are a lot of things you can learn from space. So make yourself comfortable, watch my videos, feel free to leave your thoughts and your comments, like my videos, and if you enjoy my content, consider subscribing. No. You're going to enjoy my content, so subscribe and turn on the bell icon. So in today's video, I'll talk to you all about something very interesting. I'll tell you 5 things that you should know before using a medication and while you're using the medication. Before I go on to list these 5 things, let me just say, when you feel ill or you have some symptoms, don't just go to a random chemist or a random pharmacy and just buy any random antibiotics, any random painkiller. Because before you take any drug, anybody that is prescribing any drug has to know your background health condition. Because one person is taking a drug doesn't mean it's the best drug that you should take when you feel the same symptom. And don't just go and buy random drugs. Always get yourself checked, run tests to make sure you know what is wrong with you before taking a medication. So let's just get right into this video. First tip is that you should know the name of your drug. Know the name of the drug you're taking. I know this may sound unreal, like why am I saying know the name of the drug? I promise you, there are a lot of people that are on medications and they've been taking these medications for years, and they come to the hospital and you're like, what drug are you taking? What drugs have you been on? And they actually do not know what the drug is. They don't know the name of the drug. Like, you should know the name of drug, and it's very easy because the name of every drug is written on the pack. So before, when you're prescribed a drug, when your doctor gives you a drug, you can feel free to ask them. If you can't read their writing, feel free to ask them, doctor, please can you tell me what this drug is and the name. So know the names of the drug you're taking. Okay, so my second tip is that know the function of the drug, know why you're taking this drug. Again, I'm going to say, some people have been taking a particular drug for years and they don't even know the effect of the drug, or they're taking a particular drug and they think they're taking it for this reason. Okay, let me share this experience with you. I've seen someone who was trying to get pregnant here, and she went to a pharmacy and she was given a drug. And when I saw her, she showed me the drug that she's trying to get pregnant, and someone gave her this drug. She bought her at the pharmacy, and guess what she was taking? She was taking oral contraceptive pill. I'm like, you're trying to get pregnant, but you're taking something that just prevents you from getting pregnant. So it's very important that you actually know the name of the drug you're taking, and even going beyond that, to know what the effect of the drug is on your body. Know what the drug is doing for you. Like, what condition do you have that you need to take this drug? It's very important that you know this and you take the right drug, so you stop causing harm to yourself. What if there's an emergency and you've been on a drug and they need to give you that drug? There's nobody around that can tell. Maybe your son or your daughter probably knows the name of the drug, but you don't know the name of the drug. How are you going to help yourself? How are you going to tell them that this is the drug you've been on? So it's very important that we know the name and what effects the drug we're taking has on our body. So my next tip is knowing the dosage of the drug. I don't know why it is so, but a lot of people don't feel comfortable talking to their doctors, asking them questions. If you go to a hospital and the doctor prescribes a drug and it's like, okay, go and get the drug from pharmacy, feel very free and comfortable to ask them questions. So it's important that you know the right dose to take. If you're going to take 20 milligrams of a particular drug, take 20. Don't feel like, oh, I'm actually getting worse, I should take 30. The maximum dose of that particular drug may be 20 milligrams. If you make decision by yourself by taking 30 milligrams, you may be causing more harm to your body, because if you speak to your doctor, he may likely add an additional drug and not increase the dose. So make sure you know the right dose and you take the correct dose of medication. If you're to take the drug morning and evening, or if it's specifically written to take the drug at night, there's a reason why you were told to take it at night, and you should just comply and take the drug at the right time and take the right dose. So my next medication is duration. I know this duration thing, almost all of us are guilty, including myself. But it's sad that we do this and practice these things. If you're giving, let's say, an antibiotic, or you're on an antibiotics, you have an infection and you've been given a certain antibiotic to take, and they tell you to take for 7 days, and after taking for 3 days you feel better and you just drop it, what you're doing to yourself is that you're going to cause antibiotic resistance. So when next you have an infection, that particular drug will not work. And if you're giving a particular drug and you're told to take it for 3 days, please take it for 3 days. Don't take it beyond 3 days. If after 3 days you still feel those symptoms or you have no relief, it's better for you to go to the hospital and meet a doctor. Or if you can find a doctor that prescribes the drug to you, you can tell them that you still don't feel any relief and they're in the right position or in the right place. They know better if they're going to make you continue taking that drug for a longer time, or if they'll place you on a different drug. Painkillers like NSAIDs, ibuprofen, diclofenac shouldn't be taken longer than stipulated. Also, when you're on steroids, you shouldn't take it for longer than stipulated because they have a lot of side effects. And if you expose your body to this drug longer than you should, you're going to come down with more illnesses. So in place of tackling a certain illness, you're giving yourself and bringing more illnesses to yourself. So let's just try to avoid that. Okay. The last but not the least tip, it's very important that while we're taking a drug, we should understand the side effects that it can cause on our body. It's very important that we know the side effects that may occur. We should learn to read more about drugs. If you understand the side effects, you know why it's very important for you to abide by the rules you've been given. So I've come to the end of this video. Thank you for watching to this point. If you watched to this point, I really appreciate you, and like, you're just the realest. Thank you so much. Feel free to watch my other videos. If you're yet to subscribe to my YouTube channel, please do that, and also turn on the bell icon. Share this video with anybody that you think will benefit from this video, and I'll see you in my next video. Bye.
Go, 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 go.